Hello, Women's Advantage Men's Optimal Health family. I am Sarah Pizzey, physical therapist, and I am joined by Yesenia Lopez, our PT assistant extraordinaire. And today we're going to be presenting on the effects of gynecological cancers and how we address the treatments in rehab or in physical therapy afterwards.
What is gynecological cancer? It's considered uterine, endometrial, cervical, ovarian, vulvar, and vaginal cancer. And in 2018, 1.31 million cases were reported worldwide, of which people received surgical treatment or radiation treatment, which may contribute to increased prevalence of pelvic floor dysfunction, which also may increase the cause and risk of neuromuscular and vascular damage to the pelvic floor muscles.
All right. So when we have patients that come in following some form of treatment for gynecological cancer, they've also often come in after having a surgery and or experiencing chemotherapy or radiation. And these different interventions, although life-saving, can lead to various types of pelvic floor dysfunction, including dyspareunia, which is also known as pain with intercourse, urinary incontinence, or fecal incontinence. And the reason for these problems often occurs because with surgery, you have scar tissue, which can decrease the mobility of different structures, whether it's a visceral organ or a connective tissue or a muscle. And then same thing with treatments like radiation, for example, is that they can also stiffen tissues. It can cause atrophy and stenosis of tissues such as the vaginal canal, which can lead to pelvic floor dysfunction. And so we will get women who will come in reporting pain with intercourse, leaking during or bladder leakage, urinary incontinence, or problems holding back feces or gas, for example. And so in physical therapy, we are trying to address these different issues. And so we're going to be looking at some research on how our types of treatments can affect these things.
What does the research say? We looked at a systematic review where there were 886 participants, of which had uterine and cervical cancers, and they had stage 1 through 4 cancer. And of these research, they found certain aspects, including sexual function, and found that pelvic floor muscle training, which included yoga and core exercises, did help improve the pelvic floor muscles. Quality of life, there was an improvement with the help of counseling and yoga and exercises. And bladder and bowel functioning, there wasn't much evidence to support, just because there wasn't any data that was consistent across the board with these studies. And so we did find that with quality of life, they used biofeedback and electrical stimulation, which did help as part of their evidence in these studies.
All right, so what are we going to do about this? How is this study going to help us in our clinical decision making? So with pelvic floor muscle training, that can involve both learning how to lengthen and relax the pelvic floor muscles, but also learning how to strengthen the pelvic floor muscles. And so it's really important for us when we're doing our initial evaluation with the patient to understand exactly what kind of function these patients have regarding their pelvic floor function. Is it going to be appropriate for us to strengthen right away? Is that the primary problem that's leading to some of these difficulties? Or is it a matter of where the tissues are a little too tight and therefore they're not able to function the way that they used to? And so therefore we need to start out by learning how to lengthen and relax the pelvic floor muscles a bit more first. We end up doing a lot of core strengthening to make sure that somebody's physically able to maintain good postural control. Core strengthening does involve the pelvic floor quite a bit, so we need to make sure that somebody's able to appropriately stabilize through their core using their pelvic floor muscles, their transverse abdominis, deep pelvic or deep abdominal muscle, their diaphragm, using pressure management and how they're breathing, and some the last muscle of the core is the multifidus, and so making sure that patients are maintaining good spinal alignment. And then we use the information from our evaluation to address the bladder, the bowel, and the sexual function as it relates to the pelvic floor. So we're going to make decisions on whether or not the strengthening is important, the pelvic floor lengthening, but also if other interventions, aside from pelvic floor specific training, if other interventions such as vaginal dilators might be helpful, especially if the individual is experiencing dyspareunia or the pain with sex. It can be because the vaginal canal has become a bit stenotic, meaning that it's narrowed, so therefore it's going to be harder to tolerate full penetration. So we might teach a patient on how to use vaginal dilators, which is something the study also looked at, and if that's going to be appropriate for each individual patient. And then making sure that we're giving lifestyle modifications, helping with bladder retraining, bowel retraining, basic education regarding things like fluid intake and nutrition, and establishing a good bowel routine, and then also recommending sending out to any other providers as is necessary to make sure the patient establishes the best quality of life.
So in conclusion, a healthy pelvic floor function is essential to consider the survivorship of gynecological cancers. And we know that conservative treatment, which can include use of dilators and pelvic floor muscle training, can be effective to improve a person's quality of life and sexual function.
All right, so here's the reference of the systematic review that we looked at today. And I also want to let you all know that stay tuned, because we're hopeful to have a gynecological oncologist joining us for a guest speaker interview in the next few months. So please stay tuned for that date if any of you are interested in hearing more about what types of interventions are expected and what the doctors usually see in the aftermath of some of these procedures that patients will undergo, and how they work with pelvic floor muscle PT and maybe other providers. And then next month, July, should be our topic of pregnancy and birth. So stay tuned for some Facebook Lives and a guest speaker interview in the month of July on those topics. Thank you very much for joining us today. Bye-bye.
Bye.